Hi, you're watching Full Arch Innovators with Randy Alvarez. I'm Randy Alvarez. We're talking about business breakthroughs behind multi-million-dollar full arch practices. And my first guest, many of you know who he is. Maybe you've attended some of his courses. You use his Powerball screw. He has strong opinions about implant dentistry and how it should be done, etc. And so we invited him on. Dr. Abenaim, welcome to the program.
Hey, Randy, thank you so much for having me. I'm so honored to once again share the screen with you.
Okay, good. Now, how long have you been placing and restoring implants?
I'm almost at 20 years.
20 years. And what's changed in those 20 years?
Oh, wow.
Lots of changes.
Wow. So much has changed in a sense that it's hard for me to summarize it in a quick little things, but I could say that probably what we could have gotten away with before, we can't anymore. People are more educated. People demand more. Our skill has to be top notch. We no longer get second chances. The aesthetics have to be almost as good as veneer cases. You know, in the past with implant dentistry, it was just replacing a denture and people are like just grateful enough. But people are more and more people are getting implant dentistry and they're sort of giving up on their teeth, that the expectation is much higher.
What was the longest or the biggest learning curve for you? Is it the surgical excellence? Is it the clinical, the excellence in the consult room? Is it, what was it? Like what was the biggest change for you? And how much does experience matter?
Yeah.
It sounds like an obvious one.
Yeah, dentists in general, I would say they're programmed to think, especially when they come out of school, to be like, let me get as much continuing education as possible. And if I have X amount of credits under my belt, that means I am now qualified to do the cases. And I can tell you, Randy, that after 20 years of doing this and teaching thousands of dentists and treating thousands of patients, I'm still learning, and I'm not learning the clinical part, I'm not learning the technology part, but learning people. And you know that you, Randy, your generation is different than someone else's generation, and you think differently, you expect differently, time management for you is completely different than everyone else. So as a clinician that's, practiced in the early 2000s, 2010s, 2020s, I would say for the past 20 years, I've been in my practice through so many massive life world events that has really changed humanity. And I think the hardest part of being a full arch implant dentist is people, to learn how to deal with people. And I don't even think it's a curve, because a curve at one point plateaus, but this is something that you continuously learn, and more importantly, you continuously become more cautious about who you treat, how you treat, the words that you say, the cadence that you speak, the eye contact that you give, how you sit in front of a patient, how you dress in front of a patient. These are things I would probably tell you are maybe more important than clinical dentistry.
Is that right? And so what are mistakes that newer guys make, or maybe they don't understand yet? They don't know what they don't know when it comes to patient interaction, talking to patients.
It's very easy to place a screw inside a bone. It's very easy to take teeth and screw them into another part. And everything is all fun and games. The question is, what happens when your patient doesn't fit into that bubble that you think you created, that you learned, that lecturer taught you, because maybe you saw 5 patients, 10 patients, 20 patients, 30 patients, even 100 patients, and all of a sudden it doesn't fit. What do you do? Do you know how to do it? Are you ready to be able to deal with that complications? And I could tell you, implant dentistry is being remade now more than ever. Now, I'm not certain if it's being remade because it's poor, or because when a patient walks in with 4 implants on top and 4 implants on the bottom, the dentist is like, oh, this patient can actually pay for dentistry. Let me convince them that they need to redo it.
Is that right? Specifically, give me an example.
Specifically, like, the best phone call I always get, and if a patient is listening to this, let me tell you, if your dentist tells you that he's an implant expert, but he needs to call your previous dentist to find out what type of implants were placed, they probably have no idea what they're doing. Because if you've been in implant dentistry long enough, you can take an x-ray and know exactly the type of implants. And that's, I'm telling you, if they're placed in like major world centers, not like in the middle of the jungle somewhere where somebody used a, fake screw from the floor that you've never seen before. But most people use all types of implants. One telltale sign is that if your dentist cannot look at an x-ray and know what type of implant it is, they should probably not be doing your case.
Does that only come with experience? Is that something you could learn or teach?
I can tell you that when I first started 20 years ago, when I bought my practice and I was in massive debt and I didn't know what I was doing, I read a lot of John Grisham books in college, and I read Stephen King books, but when I started my practice, I read every single catalog that the implant companies had. I went on the internet, whatever we had of the internet, every x-ray I could possibly get, and I looked at every single screw that was there so that I can study every part that's available, every prosthetic part that's available, every drill that's needed. I made sure to master my craft, because if I had to go and treat a patient, and it's not like when you go to the doctor, you show your medical card and you pay a $50 copay. You are taking a tremendous amount of money from people, and most of the time from people who probably are giving you their last dime. And God forbid you should take that money and do dentistry on people when you're not qualified. Maybe if you really want to do it, because the pundits will say, Randy, well, how are we going to get experience? No problem. You want experience? Don't charge the patient. Do it for free. Do it for cost till you get under control, so that when you fail and when the case takes 50 visits instead of 3 visits or 2 visits or 1 visit, the patient's like, well, whatever, I didn't pay for it. You need to be honest with yourself.
So you recommend that. How many years into it do you feel like you really fully understood the surgical part and the pros part together?
I think that for me, probably when I invented my process in 2017, so that means I was already 12 years in, and I forced myself to not only do the surgery, the prosthetic, but also the lab work and the design work. That's when I fully started to really understand what it took. And I think a lot of doctors have that missing. They'll either do the surgery, either do the prosthetics, either do the lab, and there's so much disconnect. You really have no idea why you're reducing bone, why you're not reducing bone, why you're using pink, why you're not using pink, why you're using a tie base, why you're not using a tie base, why are you using a straight abutment, why are you using an angled abutment, why are you using this type of implant, why are you using that type of implant, why are you using this tissue, this bone graft, this prosthetic material. There's just so much that's involved. If you have no idea, you have no idea. Because
do you think new guys get the impression that it's easier than it really is?
Oh my God, I knew that you were going to ask me this question, not just because, but I'm like, I know Randy's going to ask me this question because it's a tough question. And I said, how am I going to answer it? And I remember myself when I first started, how did we learn? We used to hear from our professors, or we used to go to a course, right? You used to go fly out to Vegas or fly out to Chicago, and you used to take a course. And the lecturer usually showed you a case that was so difficult and told you how hard it was that you really left the course saying, there is no way I'm doing this. But really today, there's social media, and people like me or people that that are on top of their game post these cases over and over and over, and people are like, oh my God, it looks so easy. Abenaim is doing it. This guy's doing it. That guy's doing it. It must be really easy. And then they do it, and then they lose money, and then God forbid they may lose their license, and then they're like, shit, I should have never done this.
So, and this only comes with experience. Because look, in marketing and advertising that we specialize in, it's difficult to market experience. And especially, I want to ask you about, as an implant dentist, talking about experience, about what could happen if in the hands of an inexperienced person, almost puts you on the defensive in your presentation. So how do you handle that? Selling, as they say, experience and why it matters. Because it is a tricky one without sounding like, come to me, those other guys don't know what they're doing.
Yeah, so I could tell you that in my practice, I will never, ever, ever, ever talk bad about another dentist. And I do a lot of revision cases. And they always say to me, did the other person mess up? And I said, I have no idea. I wasn't there. Can you write me a letter that says that this person messed up? I said, no, because I wasn't there.
I
And
wouldn't guess. I wouldn't have guessed that about you, by the way,
well,
Jonathan.
here's the thing. I don't need to put other people down to push myself up. I could stand on my own 2 feet. And let me tell you, if you think that by you putting another colleague down in front of a patient, it makes you look better, it makes you look like an idiot. Because guess
There's a lot
what?
of that. Is there a lot of that going on?
I think by the people that are inexperienced, they are for sure doing that because they have nothing else to stand on. So they'll go and say, oh yeah, he messed up. Like as almost they were a prophet. Like I wouldn't have done it this way. Well, you weren't there. You didn't know if the patient didn't open enough. You don't know if the patient gagged too much. You don't know if the patient moved all over the place. You weren't there. You have no idea what happened. You have no idea if after the surgery that was done perfectly, the patient took a water pick and started destroying the whole surgical site. There's so many things that can happen that the patient is involved. Why in the world would I ever put down my colleague? What I will say in terms of your original question is that I feel like my interview is like defensive in a sense that puts me on edge. It's not that. It's that, I always say this. If I always go back to my mission statement that I wrote 25 years ago when I was in dentistry, when I was in dental school, they made us write a mission statement. What's your mission statement about becoming a dentist? And it was 1 page. And the gist of it was for me was to change the brand of dentistry. And I wanted to change the brand of dentistry. I hated that when you go to a cocktail party, people say to you, what do? I'm a dentist. Ugh, I hate the dentist. Or, oh, I'm so scared of you. And my dream was always to change the brand of dentistry to be able to give the patient the best experience possible. And that means even not doing any dentistry on them. And that could say like, come and have your teeth cleaned. Come every 3 to 4 months. And you won't need to get the dentistry that you claim to hate. But if you wait till your face is abscessed out and all your teeth are on fire and we can get you numb and it's really difficult to do this and the post-op is very hard because of the infection and the amount of work that we had to do and the acrobatics that we had to do, yes, it's a necessary evil. It happens. But if you can change the brand of dentistry to make dentistry welcoming for these people, and allowing them to come in and be like, I actually like going to my dentist. And people say to me, I actually like coming here. Once we fix them up, right? They're like, I like coming here. It's so easy. Yeah, because now you're healthy and all you got to see is my wonderful hygienist. You don't need to see the big bad old dentist. And that's the thing, I would tell you, you told me about the learning curve, Randy, and I'm sure you see it yourself in your own business. Dentistry is a business. And people hate to talk about that. I don't sell. It's a business. You have a service, you collect money, and you give it out to them, and that's it. That's the way it is. It's not free. It's not a hobby. It's a business. And I can tell you that with my social media presence, with my marketing, we read a lot of comments from people. And people hate the dentist. But the problem is they hate the dentist in the wrong way. They're so upset that it's so expensive and that they can't afford it. And they assume that the dentist is the bad guy. Right? It's like someone says to you, Randy, it's so expensive for you to record the show for me. And you say, well, do you see the set? Do you see the equipment? Do you see the time that goes into this? Do you see the editing that this costs money? And the people that are upset probably say, I'm not doing Randy, he's too much money. But the people that understand the power of the wellness hour and the power to be able to educate people, to be able to meet your doctor for 30 minutes without going into the office, like that is extremely powerful. And that's, I've been doing the wellness hour for a really long time. And people say the wellness hour brings in a lot of this type of patient and that type of patient. It's the people. It's the type of world that we live in. And you need to be able to go out there. And I can tell you that when you're able to present yourself in the brand that you created for yourself for 30 minutes unscripted really, because your questions are hardball. People say to me all the time, man, that guy Randy was tough on you. When they come into my office, they say he was tough. I'm like, he's a good guy, but we say the truth about what everything is. It doesn't matter. You could ask any question you want. Anyhow,
when you present to patients, if there was like a pie chart on this, how much do you place on, what percentage on the future of being better off, what these implants are going to do for them, and how much do you spend on the process of what you're going to do and how you're going to do it?
Yeah, so I once heard this really good-looking great teeth, amazing hair, skinny, tan guy teach about the power of influence. And he taught me that when you speak to people, you need to be able to influence them. I was talking about you, Randy, if you didn't know.
Well, that's nice of you.
To the power of influence about the way you speak to people. So when I look at the patient that's in front of me, is the person an engineer? Is the person male? Is the person female? What's their background? What is important to them? And that's what I really focus on. If the story at the end of how they're going to feel and how they're going to look is what's motivating them to actually go forward, that's what I use to influence them to allow me to do treatment on them. If they want to know about the nitty and the gritty, I kind of get a little bit scared, because they're the ones that ask you how many implants, what type of implants, what color are the implants, what size are the implants. And those people are almost the people that will eventually tell you at the end of the day, this embrasure is about 2 degrees off than the other embrasure, can you redo my teeth? And that's someone that I would probably say, maybe I'm not going to treat you, because I think that eventually you don't realize that this is nature. We're trying to recreate nature, and nature is not perfect.
Yeah, and look, I have a plastic surgery buddy, and he was telling me the same thing. He goes, some surgeons attract people that, like, look at my brow. You can't even notice it. It's a half a millimeter higher than the other. Nobody can notice it. Or look at my nose. It's pointing a little bit offset. He said those are the red flags of people that are looking for perfection. He'd rather people that just want to look great for their age, that want to look rested, and that they're reasonable about their self-esteem. And that goes with all types. And I think that with dentistry, it's the same thing, that you're not just giving a cookie cutter presentation. It sounds like you're tailoring it to their situation based on what their goals are and what they're trying to do. And do you also introduce things that they didn't anticipate? Maybe the guy just wants to be out of pain and be able to smile again. Or what if a person wants to eat a steak again? How much tailoring are you doing based on that? Or talking about their future and what, like they're going, man, I believe you, I trust you, I like you. Is there anything you talk about maybe that they don't even realize what they're about to get involved in as far as the benefits?
Again, it really depends on the patient, because sometimes the patient, if you give them too much information, you know what they say at the end? I'm going to think about it. And the reason they say I'm going to think about it, all the salespeople always tell you that the reason the patient says I'm going to think about it, I'm going to speak to my wife about it, is because they really don't understand. And because maybe you gave them so much information that they're so confused, they have no idea where to go. And one of the things we try to do is we try to see, like, where is it that they really want to go? And then we sort of like direct them to that area so that they don't look at anything else. In my waiting room, there's no magazines. There's only before and after photos. On the TV, there isn't ESPN, there isn't CNN, there's Randy Alvarez and all the other social media stuff that we're going. Because when they come into my office, all I want them to think about is themselves and their teeth.
Wow.
I don't want them to think about their vacation that they should take, about a new furniture that they should buy. No distractions. Because let me tell you something. Every single, and I will say this with a stamp, every single full arch implant patient has been telling themselves before they walked into your room, I don't deserve this, I don't want this, I don't need this, I don't want it, it's too expensive, I'm afraid, run away. And their brain has been telling them this over and over and over. And then they either saw your beautiful face, Randy, on TV, or they saw something on Google or social media, or they heard something, and you had this small opening of, I do deserve this. I shouldn't be suffering. And then we try to continue that thinking, because what will usually happen is they will revert very, very quickly to no, 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 no. And we need to get them back to that small percentage of yes, 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 yes. And that's why when you see these patients, and full arch dentists, especially young dentists, will tell you, if their presentation isn't strong enough, they will close the patient. Okay. The patient will go home, and they will think about it, and what we call the external influence will go ahead and tell them, are you crazy? Why are you spending all of that money? Whether it's the people ready to inherit the money, whether it's their spouse that doesn't want them to look that good because they don't want to lose them, and then they will call and they will cancel.
So
because
with a good consult, your belief that is you could create demand. What I like is you're showing them before and after photos. while they're in your waiting room, you said, you have videos that are showing what's possible, and you're creating, in a way, some sort of a demand, and also you're lowering their fears. Could you speak to that and why that is so important? Because so many dentists, they don't have before and after photos, they don't have videos, they don't have those things that are helping them build value. And one other thing, I tell my team this all the time. If people don't do business with us, if they say it's for one reason. It's not usually because of the money, it's because they don't think it's worth it. Same thing with patients. If they don't want to spend the 25 or 30,000 or whatever it is per arch, I say they just don't think it's worth it. If they did, they would do whatever they can, they would save up, they'd put a savings plan together, they'd borrow money to get this done. Could you speak to that?
That was a lot.
As far as making them justify the price, that's really my question.
Here's the thing. If you vet them correctly, dentistry, like I told you before, it's a business. And if you needed to go and buy a house, let me tell you something. Real estate agents do not make money until it closes. Dentists will not make money until it closes. But let me tell you something. A real estate agent will never, ever take you out to see a house unless you have a pre-approval or you have guaranteed funds. And what's happening is people are just bringing in all these patients that are calling. We get almost 100 to 150 calls a day of patients. Wow. Our phone is, we can't answer the phone. It's too much.
150 calls on just implant questions, things like that, a day?
Full arch patients, 150 patients a day. I had to silence my phone now because the phone is just ringing. But it doesn't mean anything because everybody wants a mansion. The question is, can they pay for the mansion?
Are you finding more and more people are saving up for the procedure? Sorry to interrupt.
No. I think people are being more and more reckless with their money, or even better to say, not reckless, but we're living in a time where people really don't have any money. And what I mean by money is that they don't have access to money. They're tapped out. Their credit is tapped out. We're in a time that's really scary. And banks are, when I say banks, I don't talk about like Chase, Wells Fargo. I'm talking about like healthcare banks are getting smarter and smarter because the patients are not paying back their loans. So they're not giving anybody any money. And then when they do give the money, the interest rates are extremely high. So for full arch, we're entering into an area where it's it's going to be very hard. And if you're not built lean and mean, the answer is not to lower your price. I know a lot of people love to boast about their 50, 60, 70 arches, their 15 offices. And congratulations, this shirt is not from Walmart. I don't want to wear a Walmart shirt. I want to wear a nice shirt. And the same thing, like my dentistry is worth a specific amount of money. Not because my materials are better or my implants are better, but because of the amount of time that I spend thinking about your case, planning your case, investing in your case, till I actually finish. I never stop thinking about that. And that costs money. And that's what you're essentially paying. Again, it's very simple to do 70 arches a month or 80 arches a month. You're not thinking about this. You're on autopilot. And that's also okay. It's totally fine. When was the last time you've been to Costco? You go to Costco, there's nobody helping you. You buy one big ass bottle of ketchup, or they force you to buy two, and you got to find it. You don't know what aisle it's going to be in. Most of the Costcos are the same. But you want to go to Gucci, and the lady's there and helping you, or Brunello, right? Or Dior. Dior is not lowering their prices because Kmart or Walmart is having a best value every day. And I think dentists that are lowering their price are really not helping the industry. They're almost fueling the last ad I saw. It was so funny. I saw an ad the other day that said, "Don't let your dentist overcharge you." I wanted to make an ad, "Don't let your dentist swindle you," because obviously, if he's doing it for so much cheaper, right? If the average cost for an arch is anywhere between $20,000 and $30,000, and they're doing it for $9,000, what do you think? That we're so greedy? I make the implants. I make the parts. It's not that you're so greedy. At the end of the day, something needs to be cut. It's like almost like, do you want to watch it in 4K or black and white? Black and white is fine. I don't know anybody that's ever said they want the cheapest heart in their body. Nobody wants that.
But the truth of the matter, look, I go inside of practices every single day. I talk to guys all over the US, all over Canada, they're implant dentists, and they're all charging about the same amount. In fact, the new guys, because they're using two different people, different labs, outsourcing everything. I had a guy that I just turned down for an interview, wanted to do implants. We had to talk about something else. We turned it into a cosmetic interview. But, the guy's charging $36,000 and he hasn't done a full arch yet. And I feel like it'd be a disservice for me to put him on TV and let the public go there so he could learn on the people that come in. And so, but everybody has to start somewhere.
Yeah,
right?
and I could tell you that when I started my process, and that's me, like inventing all of these patents that I have to bring implant dentistry to the digital world, I did it for close to nothing. Because I wasn't sure if it was going to perfectly work. Again, it was fully sound. It's not that I was experimenting on the patients, but I wasn't sure if this new material for teeth was going to be correct. I wasn't sure if this new digital process was going to work. And not that they would have a botched case, but I may have to revert to the old way of doing things, and I just essentially needed their time. Right? I was never going to hurt them. It was just that I wanted to try something that could possibly save you time and make your life that much easier. But let me try it because it's never been done. And when I say, Randy, it's never been done, before I did this full arch of implant dentistry in digital dentistry, it was never done. And anybody says that they're digital, they were not. I was the first. Period. Nobody did it. You know why? Because when I did it, my life was threatened. They said to me, when you come to your conferences, if you ever come there, we're going to beat you up. Because what you're telling people is possible, it's not. People were telling me that you're doctoring your x-rays because what you're doing is impossible. But now, Randy, how many people on your show come and say they're full arch digital dentists? They say it all the time.
Yeah.
They don't tell you where they learned it, did they?
Yeah, well, a lot of them learn from you. Your name is brought up all the time. One of the things, look, people say a lot of things about you. Everybody agrees you're super passionate, strong opinions. But what I tell people, because I've gotten a chance to know you a little bit over the years, I said, one thing about him is he actually cares. I think his frustration comes from, and his passion, this is just my opinion, is that you care. You care about what's best for the patient. You care about what's happening in implant dentistry. You care about some of the false advertising or misleading advertising where they think they're getting a full arch of teeth and it's just a snap-in overdenture. You seem to care. Is that?
Yeah, it's because, the thing is, Randy, remember what I told you about 15 minutes ago when we started this podcast? I want to change the brand of dentistry. I want dentists to be not the butt of jokes at a comedy club. I don't want dentists to be the person they hate the most at a cocktail party. I want dentists to be the heroes of medicine. We're the people that really help people get healthy. It's the first step. Everything goes through your mouth. And if your mouth is unhealthy, and more importantly, if you spent money and somebody who wasn't qualified did dentistry on you, it's bad for dentistry. It may be good for your wallet, but it's bad for dentistry. And when you keep doing ads that says, don't let your dentist overcharge you, it's bad for dentistry. And it's not about me doing all of the cases. Like, there's enough cases. I've done enough cases in my career to say I never have to do a case again. But I keep doing it because there are people out there that need the help. And there are people that, and especially with the big chains of dentistry, I just did a case. The patient had her teeth done. She spent over $50,000, maybe $60,000 at one of the big chains, okay? And she cried. I said, I can't do your case. She goes, I'm begging you. I've been to 6 offices. Nobody wants to help me. I have lost over 30 pounds. I had dentures before. I was fine. Now I have implants and I cannot eat. And she said, they're not helping me. And this is what's out there, and it's going to come out more. So when you ask me how many years does it takes 5 years for you to start to see things fall apart. The mouth is unbelievable, but 5 years is when it starts to fall apart, and that's when you start to learn what works and what doesn't work. So when you tell me that you've been 2 years out, but you have 6,000 hours of CE, I don't care. Treat real people honestly. Care about them.
Okay.
Don't try and save cash here and there. So yes, I'm
Let's,
passionate about dentistry.
I have a lot of questions because people want to know your workflow. But before we get into that, I started we called the full arch innovators. You're one of those innovators. You're one of those pioneers. Let's talk a little bit about your patents, your innovations, your Powerball screw, things like that.
Yeah. So, like I told you, I became
My
a
question
dentist.
really is, what do patients, or what do other dentists listening to this need to know about your innovations and how it could help them in their practice?
Yeah, so I would say out of all of my inventions, the most famous one is really the Powerball screw, which is something that I brought back that had failed early on in implant dentistry, which was to what we call skipping the tie base, which is taking the metal out of people's teeth and taking out the cement in terms of their implants. And I brought that back by redesigning a screw directly to that, and then everybody copied, and again, they said that it was their
A lot of
invention.
copies, a lot of copy
A
knockoffs.
lot of poor copies, a lot of really poor copies, and unfortunately, dentists believe fake graphs. They believe theory. They really, at the end of the day, the reason they choose something else is because their buddy is doing it, as opposed to really following the science, or following even more so the clinical evidence of how many screws have been done and how perfect it is, as opposed to saying, imagine that you told your patient, by the way, the screw that's holding in this $30,000 implant is actually $6 because I didn't want to spend money on the Powerball screw. It's too much money. Imagine that you told your patient that it's a $6 screw holding this $30,000. They would freaking kill you. The patients don't know. So
what is a clear advantage with the Powerball screw?
I mean, again, I use it in my own patients. The biggest thing is that I think it's the only. There's 3 versions of it: 1, 2, and 3. It's the only screw that's ever been invented and designed continuously for material specific and be able to change the angle and skip the tie base. So it's designed not only specifically for zirconia, resin, titanium. We have a specific screw for each one of those, and it's really easy. It doesn't strip. When it does fail, it's very easy to fix, as opposed to other parts in implant dentistry that fail is almost a catastrophic failure. It's very difficult. But in general, it's just really, people that use it, they're like obsessed with it. They're like, I love this thing. Especially the people that use it correctly, they love it. I mean, I have centers that are ran by really unbelievable dentists, and these are big centers that use my screw, and they love it.
How much is the screw?
What was that?
How much is the Powerball
$35 if you buy one.
As opposed to $6.
As opposed to $6.
Does it amaze you that dentists, to cut corners, because some rep, and correct me if I'm wrong, a rep goes in and says, you're paying $35, you add that up over 12 months, that's a lot of money. Right?
Is it?
And so no, I'm saying that this is what some of them will say, the reps, right?
But is it that much money? Think about it.
No, it's not. It's what, $40 more and you get it done right, and it's going to last longer, and
it's very interesting. I can tell you that the dentists that are the ones that cut corners are the ones that their patients cut corners. That's what they attract.
Interesting.
If the dentist is cheap, their patients are cheap. I always see the guys, like I practice in New York and New York City and New Jersey, and I can tell you that I work with a lot of New York dentists, and I can tell you the New York dentists that have these posh, gorgeous Park Avenue, Rockefeller Center offices, they do the best for their patients. And you know what? The patients just pay them. It's the dentists that are cheap, that are getting the free gauze and the free gloves and the free composite at all these conference centers. Their patients themselves are cheap because that's the aura that they bring. When you dress correctly, people around you are going to want to be dressed that way. When you look a specific way, people around you are going to look that specific way. If you speak a specific way, people are going to be that way. Like I practice in a specific way and I talk a specific way, that's the patients that come to me. The patients that come to me are the patients that want to hear it the real way. They're passionate themselves. They're like, I'm tired of my dentist trying to be my friend. I am tired of my dentist trying to tell me, oh, it's going to be okay. They're like, I'm tired. I don't want to come to the dentist. I just want my teeth to be fixed once and for all so I can go and enjoy my life.
Interesting.
I know it's hard for you California people. You don't get it.
We don't get it.
You're more delicate in that sense.
Remember,
this is a podcast. You can let go of You can let go of the tie. It's more relaxed. It's not the wellness hour. This is our
I should have
podcast.
wore a
One.
tank top. That would have
I
been
mean,
better.
not listen. If you were wearing if you were wearing a tank top, Corey would have to put you full screen. They would not want to see me. It would be all you.
How does somebody make a transition? Start slowly bringing everything in house. Like, what's the best way to do that? And at what point should somebody do that? Slowly going all in implant dentistry, because some guys, I interviewed you before. I said, well, isn't it very telling if a guy's got a printer, he's got a mill, he's got a full-time lab tech that's right there? Doesn't that tell you how serious the person is?
I think
And
that
you had a strong response to that.
I think if you made the decision to be a full arch dentist, and when I say full arch dentist, that means like you're doing full mouth reconstructions, whether it's on implants or teeth, you must, and I'm telling you, when you make that decision, when you're like, this is what I'm gonna do, like, I'm not gonna be a general dentist, I'm not gonna be an endodontist, I'm not gonna be an oral surgeon, I am gonna be a full arch dentist, and that's on teeth or on implants, I don't care. You must integrate the lab into your office for multiple reasons.
So what's it? But also make sure in this response, I'd like to know how they transition. Like, what do they do first? Do they get the printer first? Do they get the photogrammetry? I mean, what? And I'll let you continue.
Yeah. So
I just want to know how they can transition.
Yeah. So once you made that decision and that's what you're going to do, you need to start to obviously educate yourself. So once you've got the clinical under control, and when I say when you got the clinical, you got the surgery, you know how to deal with the prosthetics, you know how to deal with the phonetics, you know how to deal with all of that stuff that a dentist is trained to do, and you now basically want to be a dental technician. You know, I said this to you before on our show. My dad is in manufacturing, and my dad said to me, my dad never graduated high school. My dad's been working since he was 17 years old, and he said to me, he says, whatever business you're in, you better know how to do everything that your employees do. And I said to him, but I don't want to do what all my employees do. He says, but you're going to have to. And I said to him, why? He said, because one day your employee is not going to show up for work. Then what? Who's going to answer the phone? Who's going to submit the insurance? Who's going to do the lab? Who's going to clean the instruments? Who's going to open and close the door? Who's going to do the backups? And in my practice, I learned to do every single thing it doesn't mean I do it as well as them, but I know how to do everything in case one of them ever sent me away. So one of them decided to go. So how do they transition? They should first make that decision that they need to learn it all. So what I say to them is I would say that you now start to do everything like you are doing it with a dental technician, but you create duplicates. So if you are fully digital, you take a scan of your implants, you go ahead and add a mill and add a printer at the same time. You shouldn't do one and then the other, because when you stay with printing, you're just going to be stuck there. Go full force.
Okay.
Full force, create a place in your practice, boom, do it. And that doesn't mean you're doing it for your patients, but you're doing duplicates. That means you're paying the lab technician, whether they're not in your office yet, but they're out, as if you're doing it, and now you're doing your own. And when you're able to produce something as good as the lab sends you or better, now you're ready to do it for your patient. So in the beginning, you're not going to make money doing this lab portion, but you're going to be able to do it without putting your patient at harm. So you'll have two sets of teeth, one that you made, one that the lab made. And now you have the ability to hold your lab technician accountable. When you have no idea what you're doing and you got it done in 2 days, but your lab technician is taking 4 weeks to do it because they told you that it takes 4 weeks to do, but you're like, no, but it only takes 2 days or 3 days or whatever it takes.
Okay.
Now you can start pushing your people to be like, hey, come on, I could do this quicker. Why are you not doing it quicker? Or I can make this look so good. Why are you not making it look so good? And that's when you slowly transition out of any part, any employee that you have in your practice. When you're able to do it better than them, then you need to find somebody that could do it as good as you and then better than you. That's the key. You know, let me finish something. I just did an ectodermal dysplasia case, and one of my students sent me a text. He says, yo, great case. Who's the lab? Because dentists have this idea that, oh, the dentist sucks. The lab does everything. And I said to him, who's the lab? I'm the lab. He's like, huh? I said, yeah, I did the case. And they're shocked. Go ahead.
Well, I was going to ask you because I had a guy in here last week and he was saying, you know, Randy, I don't want to bring the in-house lab because they do it better. That's what he said to me. He goes, they do it better. And until technology catches up, then I'll do it. This is what I hear. And I hear this every once in a while. When I ask a guy, does he have a printer? Does he have a mill? And they come and they become very defensive. And I feel like somebody taught them how to respond to that. But they truly believe, and I think they're not just saying it, they truly believe, let the labs do what they do best and I'll do what I do best. What are your thoughts on that? Is it just they don't get it?
I think that dentistry innately, like if I had to meet the founders of dentistry, I would have it out with them. I think that the way that dentistry was created is so ass backwards, like from the fact that we work on patients awake, like that's ridiculous. From the fact that a lab technician is separate from the dental team. The same, imagine you had to outsource your dental assistant, like your dental assistant was in a different office. That'd be ridiculous. I think a dental technician needs to be in your office to be able to practice at the highest level. Now, if you want to do it, great. If you want to have a technician in your office, that's even better. So for someone that says, oh, I would let the lab technician do it, but do it in your office. There's no reason that your patient should be in temporaries for 4 weeks while you're waiting for the lab guy to do it. You know, I have a patient, she came in on Wednesday. No, what's today? Today's Wednesday. She came in on Tuesday. She had a complication with one of her teeth. She's getting her final prosthesis tomorrow morning. I'm not gonna make her live miserably with a temporary for 3 weeks.
What do you think about dentists, and there's a lot of them, that, and look, I'm a lay person, they're telling me, Randy, it's better to send them home without teeth one day. They're better, they're more relaxed, and then they come back the next day and you can get the reveal on camera and they're not sedated. I got a feeling you have strong opinions about that.
When I have conversations with those patients, with those doctors in the background, and you really dig, you know why they say that? It's because they don't know how to do it the same day. So they make up an excuse like, the patient's more relaxed.
They say it gives my lab more time.
Bullshit. You don't need that much time. It's a prototype. It takes 22 minutes to make it. It's not true, Randy. These are all lies that dentists have either told themselves or have been told, and because the brand of dentistry is related around the perception of dentists in the world as we're not real doctors, we're not liked, we hurt people. So dentists, unfortunately, have sort of imbued this behavior that I'm lower than thou, and I'm not that great. And the technician knows better than me, and they do it better than me, and I need to give them more time. I say to them, you went to school, you spent the money, you pay the bills, you sign the paychecks, you're the man or the woman. Believe in yourself. Step up to the game. It's enough.
You know, when learning a new skill, they say you have to go through an awkward phase. When you ride a bike for the first time, if you have kids, you know, they're falling, there's an awkward phase. Some could easily give up, but you just keep helping them and then they're riding and then it's easy. And do you think that dentists fear that awkward phase because it's going to get worse before it gets better? And that's one of the challenges.
Dentists are afraid of this. They love this. They love the straight plateau of life. And I tell them fear doesn't get rid of the danger.
But when you bring things in-house, by the way, it makes you it makes you serve the patient better. You get better results, better aesthetics, better function, all those things, I guess, in the hands of the right dentist. Like, look, when I started this 27 years ago, I had to outsource my editing. I had to outsource the studio. And once I got it, first I started with my own in-house editing. Boy, that saved some time and it made for better edits. And then I brought in, and then when I got my own studio, it was a controlled environment. The lighting was better, everything was better, and I got better results with my with my clients. Is it the
Absolutely.
same in dentistry when you bring it
Yes.
in-house, get past that awkward phase, and all of a sudden, boom, it
It's
takes
so
off?
true because think about it, Randy. Forget even dentistry. Like when you send over a contract and somebody sends you over a wire or a credit card, they don't care that you send out the editing. They don't care that there's a delay in this. They care that the end result is going to be delivered in a timely manner and it's going to be perfect at the end, right? Now, how can you imagine every single day of your life you said, Jonathan, I'm so sorry. The editing guys, they went on vacation. I'm trying to get in touch with them. Your program is going to be delayed. Imagine every single day you had to apologize for something that you didn't do. Something that you weren't able to oversee because you outsourced it all out. Now, again, when I say full arch dentists, the stakes are so high. In traditional dentistry, whatever, they use their insurance, they pay $1,000, $2,000 for the crown. It's in and out. It's not the end of the day. Whatever, use a lab. When you're doing full arch of dentistry, the stakes are so high. The margin of error is so small. Their hiccups are not allowed. They're just not allowed, and you cannot minimize them if you don't have full control. And I'm not saying that you should be a lab technician like I am. I just enjoy doing it. It's part of my zen. Like, I don't go to therapists. This is my therapy. And I sit and I work on my teeth and I put music on and whatever. That relaxes me tremendously. But if you feel like you just don't like doing that, you rather talk to your therapist, then bring a ceramist. There are so many people that you can find that would die to have a steady working job with a great dentist and do great dentistry. Because at the end of the day, people that go into dentistry for the right reasons, right? For the right reason, actually love helping people. They actually love making people smile. Imagine that your job every single day is to make people smile and make people smile look good. It's not even like you're a plastic surgeon. You're just making people look bustier. Oh, great. We're making people smile every single day. Like, what a gift. What a gift to be able to do that every day and do it well at the highest level. I think it's a gift. And probably that's why I'm addicted to it. I don't know.
Now, so what's your advice then for a general, this comes up a lot. I have general dentists that are also implant dentists. Maybe they have 2 associates, 3 associates that they have to feed for their general dentistry part of the practice. And but their goal, because they confide in me, is to become just a full arch practice. So how do you transition from this, if that's your goal, I should say? How do you transition from that full arch, or I'm sorry, big general dentistry practice that pays the bills to doing what you love to do, which is full arch dentistry? How do you slowly transition? I had one guy that said, Randy, do I open up an office next door? What do I do? But his goal purely was, I don't want to do general dentistry anymore. So what's the best way to make that transition, in your opinion, in your view?
I always say that before you do something, what is your motivation? Is your motivation just because I just don't like general dentistry? Like, you don't like doing fillings, or you just want to make more money? Because I could tell you could probably make way more money being a general dentist than being a full arch dentist, because it's like almost recession proof. General dentistry will always be there. Full arch dentistry is a much harder business, and it's not for the faint. There's a lot.
But they tell me, look, when I meet guys at this, that were started general dentists, once they start doing it, and they hear the patient stories, and they see how they're changing people's lives, and they see the differences in people, it's like they're addicted to it. And they don't want to, he said, I had a guy the other day that said, Randy, I should go start my morning, I'd look at my schedule and say, oh, I have 10 crowns, that's great. Now I look at my schedule, oh God, I have 10 crowns, right? And so this implant dentistry is the happiest group of patients. And once you start, do you think it's like that? That the patients, it's the happiest group of patients. And also the dentists that are doing full arch, it's the most rewarding, at least that's what they tell me. And but I guess a lot of people are just afraid to kind of make that leap, make that jump. And they also think, but if they think all I do is implants, they think they got all these limiting beliefs. They think I'm just going to try to remove all their teeth. So they're like afraid to even advertise the implant part of their practice.
I listen. At the end of the day, it's a business, and you need to. And they're two completely different businesses, Randy. And when you open a business, You can't be like Bobby Flay's Burgers and Burger King. It's like Burger King doesn't say, I want to open Bobby Flay's, but I don't want to lose my Whopper. It's a different business. Full arch, yes, it's teeth, but it's a completely different business. It requires a completely different set of team members. The team members that answer Randy Alvarez's dental office, please hold, cannot be the person that answers Randy Alvarez's implant clinic, how may I make you smile today? Like, it's a completely different game. You see, look, the phone doesn't stop ringing. It's nuts. Randy Alvarez.
By the way, it sounds overwhelming. Like if some new dentist is going, man, I wasn't even thinking about this. I got to get my printer. I got to get the this, and I got to get the that, and I don't know if I could justify spending $100,000 on the setup, and then I got to find a lab tech.
That's correct.
They've got all these excuses.
That's why I say, like, you need to really be ready.
Okay.
Both of your feet have to be in, because it's gonna be like this. If you're a dentist that's been sailing with your crowns and your sealants and your fillings like this, you are not ready for the this of implant dentistry. You're just not, because it involves every single facet of dentistry. Implant dentistry at the highest level, which is the full arch level, which is when you have a surgical and restorative and lab practice all at one. It's every single facet of dentistry. And let me tell you, you are sweating dentistry. Now, if you're not ready to sweat dentistry, it's not for you. And that's what I would say to them. It's just not for you. Not because you're not going to be successful, but psychologically you're not going to be strong enough. You have to be strong. You know, when you're doing a case and all of a sudden the patient's blood pressure flies to 220 over 120 when the patient was perfectly healthy, what are you doing? Are you ready? Like, are you ready? So, like, it's not a joke. And this is what I say. Implant dentistry, you're like my anesthesiologist is an MD, and he tells me, holy cow, what you guys are doing in dental office, between you and me, it should probably be illegal. We should be working in operating rooms in a hospital with patients staying overnight. But because dentistry, from the founding fathers of dentistry, created dentistry as sort of like this bastardization of medicine, where we're not real doctors, right? We do everything in the office. We do everything awake. We do everything with as little medical training as possible. But it's crazy. And I think that if people actually knew what we did, we would be able to treat more people. You know why? Because the government or insurances or lobbyists would actually be like, holy shit, this is a medical procedure. This should be covered under their medical insurance, and not by doing medical billing and then getting your money called back and getting like legit medical billing. You send a thing, you get this person is a dentulous, they're on hypertension med, they have diabetes, they're not able to eat, they're not able to be healthy, they need teeth, and dentures is not an answer for them. We're living in 2025, they need implant coverage, no problem, we're going to get them, we're going to send them to an implantologist, and it's going to be covered and they're going to be healthy. And then we could treat so many more people, and imagine how they would love their dentist. The same way they love their cardiologist, the same way they love their internist, because their internist only takes a $50 copay from them.
But here's the thing, Jonathan. If there's 30 million denture wearers or a dentulist, there's only about 300,000 dentists, maybe 150,000 dabbling in implant dentistry. If it was all covered by insurance tomorrow, there'd be like a 20, 30, 40-year waiting list, right? Rioting in the streets.
I don't think there'd be rioting in the street. I think there would be enough dentists. I think we're doing dentistry at such a warp speed, at such a high level today, that we will be able to treat them. But more importantly, these people need our help. You know how many you know what it does, at least to me, to see a patient that I'm dying to help. Financially, I can't help them because I didn't win the Powerball lottery yet. Right? I would love, if I won the lottery tomorrow, that's what I would do. I would do implant dentistry for free to everyone for as long as I live. Just because, but I would love to do it. I can't do it, but these people need my help. It's nuts. It's nuts, and we're not able to help them because of the financial manner. You didn't become a doctor to become a billionaire. You became a doctor to help people and to live a good life. And that's what people forget. I'm going to open 37 practices. Dude, you're not a doctor anymore. You're an entrepreneur, which I'm fine with. But let's be honest. That's why I say, you don't want to do general dentistry anymore? Why? Do you feel you're not helping people enough, or you just want to make more money? Because if you think you're going to make more money doing implant dentistry, you're not. Maximize your GP office. That's where the money's at. Implant dentistry is because you don't feel fulfilled in what you're doing.
It's almost like a discipline, in a way.
I think you couldn't have said it better.
By the way, you must hear all the time, because you lecture, you have courses. What are the frequently asked questions that dentists will ask you about the business of dentistry, about the workflow? What are those FAQs that you get all the time? And if you could answer them right here.
Yeah, in terms of the business of dentistry, people always say, how do you get your patients? And I think getting patients is not hard. The question is, how do you close your patient? And I think really understanding people and how they think and how they process things in their brain is the part that's going to help you. And it's not about learning anything about dentistry. It's learning about people. I love learning about people with nonverbal communication. Like I see you, the way your arms are crossed and the way you're looking to the right and left, checking your phone every single second, playing with your finger. You're a little bit nervous. I'm making you a little bit uncomfortable.
I'm on Facebook and Instagram.
Yeah, a little bit uncomfortable, but at the same time, you're kind of listening, but not listening. So I'm trying to think like, oh, what am I going to say that it's actually going to keep in mind? That's what I would say in the business of dentistry. To keep people's attention is extremely important. In terms of the clinical workflow, it just takes time. We have so much access to information now that people are learning so much faster. You can learn it. The clinical part is, as much as I say you shouldn't be doing things, you can learn it. But if you learn it with good intentions, if you're learning to learn how fast you can make money and how much you can cut corners, you always get caught. And the patient will always know. When you walk into the room, the patient will know if you know what you're talking about. And you don't have to say, I've been doing this for 20 years. I never use those words. I never tell them that I went to an Ivy League college, dental school. I never tell them that I've been doing this for 20 years. I never tell them that I'm double board certified. I never tell them that I have 8 patents. I just tell them what is with their mouth, how I'm going to help them, how long it's going to take. We do 3 things. This is the place, now is the time, and I'm your guy. If we're able to talk about those 3 things in the consultation with the patient, and we pass those information correctly to the patient, then we will close the case, assuming the patient has the funds.
How much time do you spend on being better off, and how much time do you spend on what happens if you do nothing? If they leave walking out of there the same way they came in?
There's 2 ways to sell. There's fear-based selling and there's value-based selling. When you're dealing with people that are very low income and sort of like, oh my God, fear-based selling works really, really well. But when you're dealing with very high IQ patients, very wealthy patients, the fear-based selling doesn't work, but more of what it's going to look like in the future, because they're always looking forward. So like I said to you, it just depends of who's in front of me. What is it that they want? What's important to them? If the word infection scares the shit out of them, right, and that motivates them to get their teeth worked, then I'll zone in on the infection. And I'm not lying. It's not that I can't talk about every single thing going on in their mouth, because it's a waste of time. It's just going to confuse them much. I try to zone in on their values, on what's important to them. Because if they say, listen, I ask them, why are you here? And they say, well, I don't know, my wife forced me to be here. Then I don't even talk to the patient throughout the whole consult. I just talk to the wife.
So before you begin the presentation, you want to know we like to call it internal frustrations that they're dealing with, right? Even their psychological frustrations they're dealing with as far as being judged, and the physical limitations of being, in pain, can't eat the foods that they enjoy. Are you stirring all those emotions before you, or at least digging for their motives before you present anything? I mean, do you get a crystal clear picture, like where you go, I've seen enough? Like, is that what's going on in your head? Like, man, I could help this person.
I mean, when I see them, like, if I see how, like, sometimes they sit in the chair and they're like this, they can't even look at me. And if I mirror this, the whole consult's over. Then we just get into this vortex of depression. But if I could be the light to them, if I could be if I could be the person that's their hope, and I say to them, you don't need to, they say to me at the end, oh, I hope. And I always say, you don't need to hope. I'm here. It's going to work. And that sort of like releases their fear, because at the end of the day, it's the fear of the unknown. You know, you always say, oh, what does a price shopper do? And I always say in my practice, price shoppers are the best. They're the best patients. Why are they the best patients? Because they don't know what else to ask. What should they ask you other than how much is it on the phone? Should I ask you, how tall is Dr. Jonathan? What's his skin color? Where does he live? They don't know what else to ask, so they ask the most random question that comes to their mind, how much is it? But that's not really what they're asking. They're just sort of breaking the ice. They're saying hello by saying how much
I think that they're stereotyped into so-called price shoppers. But look, here's the way we all are. A person can write a check for 70 grand. A person that has money, a person that's educated, they all know, whether they're cheap or have a ton of money, they don't want to pay for something. They could buy the exact same thing somewhere else. And that's the challenge that you're facing with all the BS that's going on. I call it BS because we don't believe in that kind of advertising, these loss leader advertising, fooling people into thinking they're getting a full arch of permanent teeth when they're getting a PMMA, or they think they're getting a full arch of teeth when it's really just a snap-in, or because of their lack of experience, they're putting the patient through a 1 year worth of bone grafting. As you told me, they spent $10,000, didn't even get an implant yet. So the cost of inexperience is big. So you almost have to become, that means when you win them over, I guess is what I'm picking up on, that when this patient, when they like and they trust you and they've heard enough and seen enough, their gut tells them, I'm going to do it. I'm going to move forward with this guy. And do you see their, like, yeah.
I can tell you that when they see the wellness hour, they already know. This is what they say on the phone. They say, I know Dr. Jonathan is going to be the doctor that's going to do it for me. So I really don't even need to sell. It's very interesting. When you have a Google or a Facebook patient come in versus a wellness hour patient, it's a completely different patient. Like the Google and the Facebook or the YouTube patient, you have to do so much more work, which is what you keep alluding to. And I don't have that many of those patients. Most of my patients are wellness hour patients. They come in and they say, oh my God, it's you. Oh my God, I didn't think I was going to meet you. And they already know, because the interview that we do together is so they get to see, who I am. They see that you put me at edge, and don't say, oh, Dr. Jonathan, you're the best, you're this, you're that. You're like, come on, man, what you're saying is not true. And I defend myself on your show. And they appreciate that, especially in the area where I live. They appreciate the honesty, and they appreciate the before and afters, and they appreciate the fact, the words that we say to them. And at the end of the day, it's all true. And when you're telling somebody the truth, it's very simple. It's when people are bullshitting and when they're lying through their teeth to patients smell it. They're not stupid. Remember, these patients are not patients that haven't been to the dentist. They're in the position they are in because they went to the dentist. They're missing their teeth because they went to the dentist. They have decay around their old crowns because they went to the dentist. We seem to forget that these people are idiots. They've never been to the dentist. These people are experts. They're expert dental patients, and they can smell a dentist that doesn't know what they're doing very quickly. So again, to the person who's a general dentist, who wants to be a full arch dentist, be ready. This is not your slam dunk patient that's going to say to you, okay, yeah, here's 70 grand. Let's do it. Although, us social media personalities that post our cases, we act and we show that, oh, it's so easy, especially with the volume that we constantly post. You have no idea. Like, it takes a lot before we actually get to touch the patient. And when I say touch, is to use the scalpel to cut or to take out the tooth or to get them numb. There is so much work that gets done before, from the advertising, to answering the phone, to vetting them, to the consult, to the financial, to the pre-op, to the temporary, all this stuff that gets before we even start working on the patient. So like I'm saying to you, you need to have the team. You need to have the support. You need to have the mental capacity to be ready for this. And if you are ready for doing this, it's freaking awesome. It's an unbelievable job, because you get to make people who didn't smile for years, who didn't go out for years, who didn't socialize, who didn't even eat for years, and only you have the ability to give this to the patient, man, come on.
big.
Now that's a gift.
You know, most dentists know that the three things people don't like about dentists is they think it costs too much, they think dentists recommend things that they don't need, and they think it hurts, right? And one of the things with a referral, the nice thing about referrals, look, I like my referrals when people say, oh, so Jonathan said it's good or so-and-so said it's good. It's much easier because they trust you a little bit more, a lot more at the beginning, right? Do you find that a wellness hour, somebody watches the 30-minute block or all your Instagram videos that you have, when they watch those, do you feel like, and you see it on the calendar, do you feel like it's even better than a referral because they self-referred? That means they committed, I like this guy, right? I think this guy speaks the truth.
Yeah, I mean, I would tell you that wellness hour patient will probably never go on Yelp and talk shit about you. They won't. Where a Facebook and a Google patient will tell you that, well, I searched on Google and there was a guy cheaper than you. So can you do it for less? Because for them, it's a commodity. They, like you said, they think that it's exactly the same elsewhere. And now you need to prove to them that it's not the same elsewhere. Where you've done every single case that's known to man. Here's all my before and afters. Right? Here's my team. We don't put you on hold when you call. We know you by name. When you walk through the front door, we stand up. We have your forms ready. We don't make you wait 30 hours in the waiting room. There isn't a billion people walking in and out in this office. This is a special, if you've ever been to a plastic surgery office, which I'm sure you have with all your clients, like there isn't a ruckus like it is in a dental office. It's calm. It's very quiet. And that's how a full arch office is supposed to be. Not the ones that are charging $10,000 an arch, because $10,000 an arch, they're all sitting there. I get it. But if you're going to the best of the best, you're going to demand the best of the best, and it's a completely different game. It's a completely different game. My general dentistry office, which is on the other side of this wall, is, let's say, 1,500 square feet. My operatory for my implant surgery is 1,200 square feet, one operatory. It's a different game. It requires so much more. But like I said, you need to be ready to do it, and I'm encouraging you to do it. I'm not discouraging you like all the people before when I was young, and I used to go to lectures and say, oh, it's too hard, don't do it. I said go into it with the right intention.
Can people DM you and get your top, like courses that you would recommend, including yours, etc.?
Yeah, why not? I love helping people. But I love helping people that have the right intention. And I can tell just from the questions that they ask me. If you don't have the same way that you don't want the wrong person on your show, like I had to have a guy, okay? I had to ban him from buying my screws. Okay. Because he had the wrong intention.
Interesting. You know what? Look, when I go inside the highest performing practices, which I work with, they'll say things like, it's never been about the money for me, right? And I've said that from the beginning. It's never about the money, and people don't believe it. Do you find that like these slumping dentists, they don't believe, oh, Jonathan's all about the money, Picos is all about the money, so-and-so's all about the money. But when you talk to them, it's not about the money. They get gratification from a whole different level of why they became a dentist. Effect. Yeah.
The money is the side effect, because if you run after money, money will run away from you.
I want to ask you two final questions. I want to talk to you, get your take on AI and how you see it in the next 12 months, 24 months, changing workflows, changing how things are done. But if you had 3 to 4 minutes, and somehow it was possible, the 300,000 dentists, and you had 3 to 5 minutes to talk to them, both some experienced implant dentist, some new dentist, what would you tell them about going all in or being successful in implant dentistry?
Okay, so you want me to talk about that or about AI?
Let's go AI second. Or let's talk, and then, but if you had 3-4 minutes, you had the platform, everybody's listening. What do you want them to know? What's your take?
It's what I said throughout the whole time that we've been speaking. Now is the time to change the brand of dentistry. It's finished. Okay. to now have more respect for yourself than you've ever had before, to understand that you actually do matter, to understand that it's okay if things don't turn out exactly the way you plan them to be. Things break, things fail. It doesn't make you a bad dentist. People quit. It doesn't make you a bad person or a bad boss. People leave your practice. Doesn't make you a bad dentist. All these beliefs, all these things that happen to you that put you down, people will sue you. Doesn't make you a bad dentist. It's just the world. We live in a world of humanity where a lot of these things happen. It's not a reflection of you. And what you should always do, and I will always say, if you always have the real, pure intention of helping people, and that means saying, this case is too sophisticated for me. I'm going to refer you to a friend of mine that's better than me. Or to be like, I am so good at this case, I'm going to do it for you so well, I'm going to charge you for it. But it's going to be great. And if you always do things with the pure intention, I promise you, it will always work out. And that doesn't mean you're not going to have up and down. But you're going to have up and down. But at the end, you'll always be in the positive. And that's the way you feel, the way your family looks at you, the way your friends look at you, the way your colleagues look at you, the way your patients look at you. If you do things with pure intentions of always having the other person's best interest in mind, because if you have your best interest in mind, there's no way you're going to be a dentist. It's just not possible. Breaks your back, hurts your head, does everything. If you have other people's best interest in mind, I promise you the side effect will be your wealth, will be your success, will be your happiness, will be your health, all of that stuff. Well, because all of a sudden you'll have time for it. You won't be putting out all of the fires, and people will respect you more and more and more.
Before we get into AI, do you think, look, I was speaking in a meeting over the weekend, and they brought a patient that just happened to get a full arch, upper and lower, and they were in their permanence for about 6 months, and they happened to be there. And the patient goes in front of the room of 40 dentists and start talking about what they could eat and how they're smiling more, and how it's just like they're back. They feel like they're hiking again. I mean, it sounded like fake, but it was so many benefits. And here's what I believe. That when for dentists that don't know the outcome 6 months later or a year later, it's going to make them a weak presenter. I think that if you have about 40 of these, 50 of these, 100 of these under your belt, hearing how it changes their life, you can't help but become a natural in the consult room. What are your thoughts on that?
I didn't, again, we're brought up with these beliefs that it's just teeth. Before you were a dentist, you were just a regular guy or a regular girl. And people said to you, it's just teeth. Oh, I hate dentists. My dad, I'm scared of the dentist. That's the beliefs you have till you decide, whatever, I'm going to go against those beliefs and I'm going to become the guy or the gal that everybody hates, right? But when you get to experience what teeth does for people that never had teeth or never had good teeth, they can't stop thanking you. And let me tell you something, for someone who has very low self-esteem, that's addicting. And dentists in general have low self-esteem. And that's why they probably want to do this. Like they say, like police officers are usually the people that were bullied. Dentists that love getting that from their patient. I used to always look to my patient when I showed them their teeth for them to be like, I love it. And when they didn't do it, I was so deceived because I was waiting for that endorphin release of them saying, oh, Dr. Jonathan, I love you. I don't look for it anymore because I don't want to be deceived because I've done it so many times. But in the beginning, when you realize how powerful what you do for people is, it's really amazing.
I talked to a dentist. I was telling him I was going to interview you, and he's been to your courses. And he said, Jonathan Abenaim, he has a way of, I feel like he could see the future of where all this is going. So with that, where do you see, as a person who can see the future, give us a peek into the future, how do you see AI changing the game in the next 1 year, 2 years?
I can tell you that I've used the AI a lot in my practice, and we failed in a lot. But the part that we use AI now tremendously is for the tasks that usually get us in trouble. And I think that doctors are going to be more protected than ever. And one of the things that doctors don't realize until they realize is that if it's not in your chart, it never happened. So one of the things that we do now, at least that I do, is every single one of my clinical notes are extremely, extremely comprehensive, because my dream is, that's why, I don't do podcasts all the time. This microphone is for my AI. I speak into my computer, my notes at the end of the day at warp speed. And the AI listens to my notes and writes it for me in a clear, concise manner. And I'm able to read it and then say, no, I want to also add this. And all of a sudden, my records are so comprehensive. We use this unbelievable company to use our phones. And one of the things that we had problems with is when the patient said, I called the office and I said this and this and this, and the girl said this and this and this and this. And now we have AI listening to our phones, because everything is recorded, obviously locally. And AI will transcribe all of the phone calls and all of the conversations that we had with the patient and automatically enter it into the chart. So I think for doctors, one of the things that AI is going to do for doctors is protect us for things that we weren't able to protect ourselves with.
What about smile previews using AI to let people know what it possibly could look like in the future? It's getting better and better. What are your thoughts on that?
If you need smile preview to close a case, you're not ready to do the case.
Do you think it helps to show somebody what they may look like in the future?
Why would I do that? What happens if I can't do the same thing as the AI? Then what? I have to write a refund check?
Well, just to give them an idea. You're not
why?
saying this is...
But why, Randy?
Okay.
Tell me why. Why do you think?
I'm interviewing you. It's not about my opinion.
Yeah.
I'm just curious.
So,
you're the guy in it every single day.
Great. So the question you should say to me is, Jonathan, do you use Smile Preview software? I said, absolutely, I use it. And why do I use it? Because I've already closed the patient. But I do know that the patient's going to go home and their external influence is going to try and shut them down. So I empower them so much so that by the time they leave, they're like, are you nuts? I don't care what you say, because look at what I'm going to look like. Not, hey, let me show you what you could look like so that you can possibly want to do this.
So the timing is important. It's to lock them in. Okay.
It's to continually remember what I said? This is what they say to themselves. No, 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 no. I don't want to do this. I don't want to do this. I don't want to do this. Too much money. It's too much money. And then you get a small little glimpse when they see beautiful Randy's face on TV and they say, yes, 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 yes. And then we try to continually have them say, yes, 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 yes. And we give them the tools to do that. Because when they come to the office from the wellness hour, they already said yes. They're ready to move forward. If they already have the money in their pocket, they're just coming for records. If they need financing, they just need to get pre-approved. As we keep them on the yes, yes, yes. Now, if I come in and I look like a slob and my office team is rude to them and the CT scan smashes them in the head and they go flying halfway across the street, they're probably going to say no. But if we don't mess up and do what we're supposed to do, they'll stay on the yes path and they'll move forward.
Okay, good. Well, Dr. Jonathan, great stuff. If somebody wants to know more about what you're doing, go to one of your lectures,
at Wellness
one
Hour.
of your courses.
At Wellness Hour.
At Wellness Hour, what do you mean?
They should just go to your page. You're the man.
Just go to us. Okay.
They don't need to learn from me. They're going to learn from you. You're the best.
Doctor. All right. Well, thank you so much.
I owe most of my success to you, Randy. I can tell you, you don't pay me to do this. I pay you, if anything. But I can say that people are probably always taking from you. I can tell you from the bottom of my heart, thank you so much for what you do. Thank you so much for allowing me to help people that couldn't have been helped, that could have never heard about us before. Thanks to your show and your team and everything that you've done. It changed my life. It changed my patient's life, changed my family's life. So I really, really appreciate that. Thank you. And I mean it from the bottom of my heart. Thank you so much for what you do.
You're welcome, and thank you so much. I think you're giving me too much credit, but thank you so much. I want to thank you again. And as technology changes and as AI changes, and I got to throw this part in, we're right now at the Wellness Center, we're working on these AI versions of myself, where I believe that if somebody, and we're mastering it. I'm going to have my full avatar. We're going to be up and running tomorrow, where they can visit our website, and I'm sure. And this is what we're going to do for dentists. They can say, "Hi, I'm Dr. Jonathan Abenheim's AI assistant. I look and sound just like doctors. I've been pre-programmed with over 200 questions, frequently asked questions about dental implants. So fire away." And you can have they can have a dialogue with you, and then they also have the option, of course, to wait till you're open to talk to you live face to face. But I think that that's going to be the future of AI as far as business, to be able to leverage your time. And so now when people, and the other part is these AI answering services. I was on the phone with an AI answering service. They wanted my business. And so I'm role playing with the AI. And I said, "How much are dental implants?" Which is about 8 out of 10 patients ask when they call. You know what it said? "Would you like mornings or afternoons?" That's what they said. So whoever's programming your AI bot, they better understand the art of human influence. They better understand what drives patients. And that's a key. And that's kind of coming up. And one of my pet peeves is getting AI answering services for the sake of it is really not going to work.
It almost tanked our practice.
Well, we got a new one coming out that's going to be strong. And I'm sure you are you working on your own chatbot? So
yeah, so we've already done a chatbot. We've done an AI answering bot. We've done
Are you doing
a lot of
Synthesia
stuff.
by any chance?
I already have my Synthesia avatar. It's already done. The biggest problem with AI right now is that you and I, we have the ability to ignore outside noise. AI does not. So most of the people, when they call the office, they have their dog barking in the background, they have the TV on, the radio on, music going, and the AI just gets so confused it can't distinguish between who they're actually talking to and who they're not. And the biggest problem is the processing time. The processing time of the AI to actually think is not as strong. Is actually it's available, but a lot of these answering service bots most of them are startups, and they just don't invest in the processing time. So they spend more money. They spend less money to just get the basics of the chat, sell it to you for $200 a month, and then it's a total epic disaster. So when they tell you, "Hey, try," it works because it's just you and them. But it's not.
I think it's great. I mean, if somebody's getting 200 new patients a month and they're a general dentistry practice and all they're doing is making appointments all day, then I think AI is great for that. But when it comes to something like implant dentistry that requires explanation, that requires handling some of the objections, I think it's not there yet, but I think it's very close. And that's why in a year from now, that's where I see this going. So Dr. Jonathan, I want to thank you for coming on the show. And thanks for all the kind words. And you're the first person on this podcast. And I thought, am I going to name this the $5 million podcast? Am I going to name it? Because I only want to have people on here that not only have displayed clinical excellence, but also have innovated this procedure, but they're also successful in their business. And they actually care. That's why we picked you first. Couldn't think of anybody else better to launch this show. So thank you very much. We'll talk soon.